clinical depression, CMS measure 134. This is a telehealth eligible measure. The definition is the percentage of patients 12 years and older who are screened for depression on the day of the encounter or 14 days prior to the encounter at least one time during the calendar year. And if the screening is positive, that there is a documented follow-up plan on the date of the encounter. You need to use age-appropriate standardized screening tool, which we will get into later. Patients who have an active diagnosis of depression disorder or bipolar disorder in the problem list prior to the date of the encounter do not need to be screened, and the measure will not show up in the clinical quality flow sheet. The workflow for this measure starts with the screening. The patient completes the 2-question PHQ-2 screening. You can either ask the questions verbally or have the patient fill them out on a paper intake form, etc. You'll find the 2 questions on a smart form either through the clinical quality flow sheet under PHQ-2. It's a smart form that will upload. After you've asked the patient the questions and had the answers returned to you, you fill that out in the form. If the score is less than 2, you're going to save your work, close the form, and you've completed this measure for the year. If the score is 2 or greater, this is a positive depression screen, and you will save the form. ECW will automatically upload the PHQ-9. You'll see that this form has the patient's name and the date of the encounter in it. You can print this and give it to the patient for them to fill out the questions. Once they've done this, you're going to answer the questions in ECW to score the form and save your work. You will also be able to find the PHQ-2 questions if you go in through HPI under Depression Screen MACRA. You'll see it here. Here's the PHQ-2 and here's the PHQ-9. Now, if you have a patient who is 13 to 17 years old and he or she has a positive PHQ-2, instead of using the PHQ-9 form, you need to use the PHQ-A for adolescent. You will see these questions in the HPI here, and you can find the form in eCliniforms. I recommend that you go from here into the patient's hub to go into eCliniforms so you don't lose the encounter. Once you're in here under Depression Screen, with a single click, click on PHQ-A, and you'll see the form here. You can print the form off from here and give it to the patient to answer, then enter the questions into the PHQ-A in HPI and save the score. Once you've gotten this far with the depression screen and you've completed the positive depression screen and PHQ-9, you need to do the second half of the measure, and that is to record the follow-up plan. You can record what you've done for the patient here under follow-up for depression. You'll find a pull down and you choose the phrase that is closest to what you've done for the patient that day. You can put it in the PHQ-2. You can also find these options in the HPI here under intervention. You'll find the same pull down. Now, exclusions for this measure include, as we've already discussed, an active diagnosis of depression or bipolar disorder. The other exclusions include the visit being for an urgent medical matter when a depression screen cannot be performed, the patient refusing, or the patient having a cognitive or functional or motivational problem such that it prohibits you from the screening. If you cannot perform the depression screen or counseling on the patient, please enter the exclusion in the in the clinical quality flow sheet. Here under depression screening not performed, click on exclusion, and you can select medical reason or patient reason. This will make it so the lack of depression screen in this calendar year does not count against you. Last note about satisfying the requirements for this measure. You must put the information in through the PHQ-2 smart form. Any shortcuts of entering the scoring of the depression screen without using the smart form will not capture structured data and not count towards your measure for the year. So creating a template with a negative depression screen answer that does not go through the smart form, or using the tool in the clinical quality flow sheet through click here to answer the little envelope that asks you to enter previous screening scores without actually opening up the smart form will not satisfy the measure for the year.